A gloomy, chilly fall day in Arkansas, and get used to this sight because it's going to be hanging around for a little while. Thanks for starting your afternoon with us here on THV 11 News at Noon. I'm Michael Aaron alongside meteorologist Nathan Scott, and this map, not something that we have seen in a long time with those colors at least.
Michael, we have flipped the script. We've gone from October into December, it almost seems like, because about 2 weeks ago we were in the 80s. Now we're talking about the coldest air of the season, and with that expectation, freeze watches have been posted for north central Arkansas. This is for Thursday morning, but I think we're going to have another opportunity Friday morning. Here's what I'm expecting. Lows, the mercury dropping down into the low to mid 30s area-wide, but you notice at 29 for you folks in Clinton. Once again, that's for Thursday morning. Out there right now, it's cool. You need a coat. Temperatures are only into the 40s. There are a few showers down into South Arkansas, and the chance of rain is pretty low throughout the day. We're going to hang on to this canopy of clouds, though, and with that northeast wind kicking in about 5 to 10 miles per hour, the numbers only warming up into the low, maybe mid 50s if you're lucky. So here's what you can expect statewide. Temperatures stuck in the 40s in northwest and north Arkansas, closer to the upper 50s in South Arkansas. Tomorrow is going to be even colder. Along with that, we've got a good chance of rain. I'll paint out all the details for you coming up later.
Children ages 5 to 11 may be able to get a COVID-19 vaccine as soon as tomorrow. The CDC is expected to give the green light to Pfizer's shot for kids today, but now many kids face another challenge: overcoming their fear of needles. An estimated 63% of kids are afraid of needles, and so are many of their parents. Dr. Tara Narula introduces us to a program that uses science, technology, and superheroes to help kids overcome their anxiety.
Azariah Bannister likes to think he's got superpowers. But when it comes to getting his upcoming flu shot, he needs a little help.
Your smart brain knows that signal isn't important to you right now.
Meet Super Meg, a chatbot that helps kids overcome their fears about needles.
They are doing the poke to help you be healthy.
Created by the Meg Foundation, a nonprofit focused on pain management, Super Meg guides 9-year-old Azariah through the vaccine process.
Everyone does better when they know what to expect.
Teaching him breathing and distraction techniques, so when he arrives at Inova Children's Hospital in Virginia,
do you want to look, or do you want to look away or look at mom?
Azariah is ready.
All right, all done.
I took a deep breath and looked away.
Science shows the source of pain lies in the brain.
Pain is not just about the needle going in the skin, it's about the anxiety.
Jody Thomas is a pediatric psychologist and CEO of the Meg Foundation.
Kids often feel like they don't have a choice to get that poke, so as much choice as we can give them. Which arm do we want that poke in? Which toy do you want to bring? Do you want to sit on my lap?
How does the debate that obviously children have been hearing from the adults around them complicate the preparation for the vaccine rollout to young children?
Kids are, of course, hearing everything. They always do. We are hearing kids talk about that they want to get this vaccination because it not only keeps themselves healthy, but it's helping take care of others. And that's an incredibly powerful message for kids. They're doing something good for the world.
You did it! For Azariah, he plans to use his new superpowers for the next big shot: his COVID vaccine.
It's a pandemic and it's very fatal. I don't want to get sick.
Dr. Tara Narula, CBS News, New York.
Here in Arkansas, Governor Asa Hutchinson is expected to talk about the state's plan to roll out the vaccine to kids during this afternoon's COVID-19 update. He says doses are ready to be distributed to pharmacies and pediatric clinics as soon as the CDC makes its decision. Health Secretary Dr. Jose Romero says the state understands that some parents are concerned about their kids getting the shot, but he says it is crucial for people to know the vaccine is safe and, quote, essential for the well-being of the children. You can watch today's 1:30 news conference on thv-at-noon.com and on the THV11 YouTube channel. Despite the COVID warnings and vaccine reassurances from health experts, people still have a lot of questions about getting the shot. Questions like, are they effective? And if so, why do you need a booster? Brandon Lewis with our Verify team has those answers for us.
Booster shots are all the buzz since the FDA authorized them for COVID-19 vaccine recipients. That's leading to a lot of claims that the need for a booster means the original vaccines were a bust, including a Kaiser Family Foundation survey that found 71% of unvaccinated Americans think it means vaccines aren't working. So let's verify. Are the recommendations for booster shots an indication that a vaccine is ineffective? Our sources are the CDC, the FDA, and Dr. William Schaffner, a professor of preventative medicine at Vanderbilt University Medical Center, who explains vaccines often need booster shots.
It's very common, and each vaccine is a little different.
The effectiveness of vaccines can wane over time. For example, tetanus requires boosters every 10 years to build on the protection from previous shots. Then there are other vaccines that require a re-immunization, like pneumococcal, which the CDC recommends a second dose for people over 65 to remind the immune system how to fight infections.
You wane, and then the vaccine will get you up to where you were before, but not any higher. So we call that re-immunization rather than boost.
There are also vaccines like the flu shot, which the CDC recommends annually because the virus keeps changing. So Schaffner says it's not all that surprising. The COVID-19 vaccine requires a booster too.
More often than not, that's the way vaccines are.
Studies show the effectiveness of the COVID-19 vaccine can drop 10 to 20% over time, depending on the type of vaccine. A booster shot can not only return that level of protection, but offer even more. So it's false that booster shots are an indication that a vaccine is ineffective. Boosters and revaccinations are actually very common among vaccines, especially those for viruses that continually change. With your Verify, I'm Brandon Lewis.
It is Election Day and millions of Americans are making their voices heard. People are watching several key races across the country today. In Virginia, the race for governor had the largest early voting turnout in the state's history. It could be a potential indicator of how next year's midterms will play out. New Jersey's gubernatorial race will determine if voters there will continue to vote blue like they did for Biden, or if the president's dwindling approval numbers will pull voters over to the GOP. Meanwhile, Boston, Atlanta, and New York City are all choosing a mayor today. And in Minneapolis, Minnesota, the city where George Floyd was murdered by a police officer in May of 2020, voters will choose whether to disband the city's police department. Here in Arkansas, Pulaski County voters are deciding on proposals to extend millages for two school systems. The first is for the Little Rock School District. If approved, $300 million would go toward building updates and renovations over the next 2 decades. The other is for the Pulaski County Special School District. Passage would fund projects like an arena at Mills High School, an indoor practice facility at Maumelle High, and expanding other campuses. Taxes will not increase if those proposals pass. Polls close at 7:30. You can learn more about today's elections on thv-at-noon.com. We'll have the very latest tonight at 5, 6, and 10. Today also starts early voting for the Central Arkansas Library System's proposed tax increase, the first one in more than a decade. That election is next Tuesday. Arkansans still have several weeks to weigh in on 2 proposed district maps for the state legislature. The governor, attorney general, and secretary of state unveiled the new maps last week. That follows the release of the 2020 census data. The public now has the opportunity to look over those maps and raise any questions or concerns. State leaders are now making it easy to see those proposed changes. They've created a website where people can find interactive versions of those maps. You can find those right now on arkansasredistricting.org.